Okay. Hi everyone. My name is Yuanhang Wang. You can call me Elaine. Today I would like to introduce some triage system, especially when there is a multi-casualty or disaster happen, so that you can provide the most effective care for the greatest number of patients. Okay. So who knows what is triage? I believe some of you already learned, especially like the delegates from Japan or Philippines or Indonesia. There are so many natural disasters happen. So I believe your country must have a very advanced triage system to, yeah. Okay. So I would like to say triage definition is to elucidate the severity and urgency to determine the priority of management. So this is just word. And the purpose of triage to assure the care quality of emergency medicine or to judge the adequacy of national health insurance policy. Okay, those are just word definition. So right now I would like to introduce just two kinds of system. First one is non-disaster. When there's not a disaster happening, so it's just to provide the best care for each individual patient, especially in the emergency room. So the first we have to divide it the triage into 5 levels. The first one, of course, second is resuscitation, and second one is emergency, the third one urgency, last urgency, and non-urgency. So I would like just briefly introduce this kind, just go through it because this is not our main point. Okay, the first class 1, especially it's emergency, right? So you need to see patient immediately. Of course, I give you some examples such as like cardiopulmonary arrest, severe respiratory distress, major burns, major trauma, massive uncontrolled bleeding, or coma. These kind of patient, we would suggest the doctor see patient immediately. So the second one is a potential threat to life, limb, or function. So the physician needs to see the doctor within 15 minutes, or otherwise the life of the patient will be threatened. And some examples are decreased level of consciousness, or severe respiratory distress, chest pain with cardiac suspicion, or overdose, severe abdominal pain, chemical exposure to eyes. So this kind of symptoms it's at level 2. And then we'll go to level 3. It's urgent. So it's condition with significant distress. And the physician needs to see the patient within 30 minutes. It's like mild to moderate respiratory distress, acute psychosis, or it's bleeding but not like uncontrolled. Such cases, it's level 3. And level 4 is less urgency. Physician can see the doctor within 60 minutes. So it's like head injury, alert, not vomiting, or chest pain but not distress, or cardiac suspicion, or depression with no suicide attempt. These are less urgency. And the last, level 5, is non-urgency. You can the doctor can see the patient within 2 hours. So it's just maybe, for example, minor trauma or sore throat with temperature lower than 39 Celsius degrees. So this 5-level triage system is mainly used in emergency department in the hospital. So it's not for disaster or massive casualty happen. So right now we are going to the next slide, which is to the very important part, that is triage system that we use in the major disaster happens. Okay, I'm gonna introduce this kind of system. It's called START. What a START means is simple triage and rapid treatment. So by using a casualty sorting system, you can focusing on your activities in the middle of a chaotic and confusing environment. You must identify and separate patients rapidly according to the severity of their injuries and their need for the treatment. So 4 level is based on green, yellow, red, and black. First, of course, you yourself need to stay calm and creating a verbal image so that you can start your job. So sorting the patients is very important, not to become involved within the treatment of the first or second patient with whom you come in contact. Like, you cannot see the first patient and you start to treat him immediately, because he might be just a minor injury and there's like other patients waiting for you to help them in later on. So the START system, it really works. So I'm gonna start with the first step. Okay, you can see the flow chart right now. Here on the left side, it's all walking rounded. First, it's to get up and walk. The first step in START is to tell all the people who can get up and walk to move to a specific area. If patient can get up and walk, they are probably not at risk of immediate death. So in order to make the situation more manageable, those victims who can walk were asked to move away from the immediate rescue scene to a specific designed safe areas. These patients are now designated as minor, just green. If a patient complains of pain or attempting to walk or move, do not force him or her to move. The patients who are left in place are the one on whom you must now concentrate. So, when you arrive at the scene, you're gonna call up, so the patients who need help, you can gathering at this place, and then please come here immediately. So those who have a minor injuries, they can walk. They just go to follow your order. So they go to maybe a ground, and it's a safer place for them to stay. And then it's the second step. So begin where you stand. So you start at the scene immediately. Begin the second step. So you just move in an orderly and systematic manner through the remaining victims, stopping at each person for a quick assessment and tagging. The stop at each patient should never take more than 1 minute. Remember, you should not evaluate the patient more than 1 minute because of the, there's so many patients out there waiting for you. So right now, in second step, your job is to find and tag the immediate patient. Those who require immediate attention, examine each patient, correct life-threatening airways and breathing problems. So tag the patient with a red tag and move on. So this flowchart is gonna help everyone to to evaluate what kind of patient is immediate patient. It's a method called RPM. So R stands for respiration or breathing. If a patient is breathing, you then need to determine the breathing rate. Patients with breathing rate greater than 30 per minute are tagged immediate, just as you can see the flow chart here. If the patient has the breathing, so you need to determine whether he or her breathing rate is over 30 per minute. If it is, then it's immediate. If the patient is not breathing, quickly clear the mouth of foreign matter. Use a head tilt maneuver to open the airway. In this type of multiple or mass casualty situation, you may have to ignore or usual cervical spine guidelines when you are opening airways during the triage process. So you're gonna, if he or she is not breathing, then you're gonna put him or her in the position airway. If it's still no respirations, then sorry, you're gonna give him or her a black tag. If it starts breathing, it has respirations, it's an immediate patient. So, the second part, if the respiration is under 30 per minute, it goes to the second step, perfusion. Perfusion is a best field method for checking circulation. So it's to check the radical pulse. It is not large and may not be easily felt in the wrist. The radical pulse is located on the palm side of the wrist. See, you can, it's here. You can feel it, right? So between the middle line and the radius bone. To check the radial pulse, place your index and middle fingers on the bump in the wrist at the base of the thumb. Can everyone feel your pulse? Okay, then slide it into the notch to the palm side of the wrist. You must keep your fingers there for 5 to 10 seconds. Check for a pulse. If the radical pulse is absent or irregular, the patient is tagged immediate also. So here, the radial pulse presents. It goes to other, and mental status. If it's absent, then you need to check its capillary refill. Also, again, if it's over 2 seconds, but it's controlled bleeding, it's immediate also. Under 2 seconds, then it will go back to mental status. So the last part of RPM series of triage tests is the mental status of the patient. This observation is done on patients who have adequate breathing and adequate circulation. So test the patient's mental status by having the patient follow a simple command, such as, "Open your eyes, sir, open your eyes," or squeeze my hand, sir, or "Miss, please move your feet forward," or just can you hear me, such that. And if the patient who can follow these simple commands and have adequate breathing and adequate circulation are tagged delayed, which is yellow. It said can follow simple command. If they cannot follow simple command, it's immediate. So the whole concept of START is used to find the immediate patient, because this system is designed to assist rescuer to find the most serious injured patient. As more rescue personnel arrive on the scene, the patient will be re-triaged for further evaluation, of course. And the immediate patient, that means, well, he or she's injury is not, not hopeless, but still have a chance to live on. So that's the basic of START triage.